Hi, welcome to Dr. Paul Show. I'm Dr. Paul. Today I want to talk about eating disorders. Before I get into it though, please press like and subscribe in order to stay up to date with the most current information. Eating disorders is something I've seen for a lot of my career. When I started in the early 1990s, I had met a nutritionist and a couple psychologists that were working with eating disorders a lot. That was really a lot of their practice. And when I met them, and they already knew that I was very interested in mental health, even though I was a family doctor, and still am. I was very interested in mental health early on, and so they picked up on that, and they started referring people to me. And so I learned a lot from them because they were basically really taught me about the subject and how to and what they did on their end as far as nutritionists, as psychologists. But they sent them to me because they needed medical treatment. So basically the three main ones, there's a lot of different types of eating disorders. The three main ones I'm going to focus on are anorexia nervosa, bulimia nervosa, and binge eating disorder. So anorexia nervosa is basically people we call body dysmorphia. So people who believe they're overweight and they're actually really thin. So everyone else looks at the person and says that person looks unhealthy, that person is way too thin. But when they look in the mirror, they don't see that. They look and they look and they pick at every little part of their body and they, well, this looks a little bit too big here and this or that. And so they look at something and they're not happy with it. So they end up starving themselves, or they eat very small quantities of food, and they can get down to, I've seen one case that was so bad that she ended up dying. She got down to about 60 pounds and, she got hospitalized, but then she ended up dying. Karen Carpenter is an example of a famous death from anorexia. But they're very difficult to treat because they're so obsessive and when you try to get them to eat more, they resist it. You're going to see it more commonly when women. It's definitely more common in women than men. It's also more common in certain sports, gymnastics, ballerinas. Those are big ones. Any type of sport where there's an emphasis on weight. With guys, it would be wrestling sometimes. Again, gymnastics, dancing sometimes. So how do you approach it? Well, basically their thinking is extremely irrational, obviously. They don't see what everyone else sees. So this is where medications come in. Medications like antidepressants and mood stabilizers try to help to balance their chemistry so that they are more likely to because most of them have depression or they might be bipolar even, and it's very difficult with just even talk therapy. So that even the therapist that I worked with and the nutritionist realized they needed medical treatment, which is why they sent them to me. Medications can have definitely help, but what they do is they get to the underlying mood problem. And it gets them more, they're more able then to see that the reality of the situation, that they need to change their nutrition. Some of them need to be hospitalized. Some of them need to go to like a program where they're there for a few months even so they're monitored very closely, and because some of them are so resistant to change that it's very difficult sometimes. They're very obsessive about what they eat. When they're eating, like at home, they think about every calorie. They look at the fat content. They think all fat is bad, even good fats like avocados or other types of good fats. So since they're so obsessive, it's and then sometimes they'll only cook on their own. They won't trust anyone else cooking for them. So again, they can be really tough and obsessive patients. Bulimia nervosa is, and again, there's a lot of mixture. Some of the anorexic patients can only do that for so long because it gets so weak. But speaking of anorexia too, there's a lot of risks involved. Not only death if it gets bad, but also bone loss. So some of these women or girls, they stop their menstrual cycles. And then what happens is their bones can get brittle, so they can get like osteoporosis, like elderly women they can get it at a young age. And that's sometimes hard to reverse. And so there's a lot of risks that happen with anorexia. And so, and there's cardiac risks. There's a lot of medical problems. Bulimia nervosa is when, and sometimes there's a switch. They eventually they can't starve themselves anymore. They get too hungry. They start eating, and then they start feeling guilty. So they'll eat and then they'll throw up. Now, with bulimia nervosa, sometimes what happens is a lot of binge eating. So they'll secretly eat till they're really stuffed. They'll feel guilty, and then they'll go throw it up. So in a sense, they get the pleasure of eating and binging on foods, and then they get rid of it so they don't get the weight gain. It's a very unhealthy habit. There's different ways of purging. There's the throwing up type of purging. There's also laxative use, using a lot of laxatives. There's also the over-exercising. Some people who exercise like 2 or 3 hours a day of cardiovascular exercise, like way overdoing it in order to try to keep their weight down. So it is very much, I look at eating disorders as kind of an obsessive-compulsive disorder, but having to do with food, whether it goes in, whether it goes out. With bulimia patients, also a lot of risks, cardiac risks. Sometimes their teeth get really, because of the stomach acid that comes up, their teeth gets eroded. They have to have a lot of dental work done because of damage to the teeth. And so again, it's also something that medication can really help. For anorexia patients, usually it takes very low doses for them. For bulimia patients, it actually usually takes higher doses. The typical medication that helps is a SSRI, like a Prozac, a Lexapro, which is not often my first line medication. If you watch my show, you know that I'm much more commonly will use other medications like SNRIs, like Pristique, Effexor, things like that. But in this case, usually SSRIs are the first line treatment. If they have a bipolar component, then adding a mood stabilizer can help. If their thinking is really irrational, and if the SSRI it doesn't get them there completely, then I combine medications. Binge eating disorder is extremely common. Now, this is people who eat way too much and they don't purge it; they keep it in. So these are the people that are overweight. So it can be, which is very common in our society. But sometimes the overweight gets to the extreme. I mean, everyone's seen these like shows about people who are 400, 500, 600 pounds. They can barely move. They're very limited because they're so big. And so these are people who are obviously self-medicating with food and to the point where they're extremely unhealthy. So now we have also cardiac risk, diabetes, strokes, a lot of risks with that. So also treatable, with medications, because these patients are also depressed. So antidepressants can help. I use a lot of times with my bulimic patients and my binge eating patients, I use Topamax. Topamax is a medication that can really help curb the cravings for sugars and carbohydrates, which are the typical binge foods. So Topamax can be very, very helpful. Sometimes a stimulant, there's one called Vyvanse, which has been approved for binge eating disorder, which is actually an ADD medication, but it also, with them, it can help to decrease their daytime appetite. And then what I do with Topamax is I give that in the early evening, because most of the binge eating, or a lot of the binge eating, happens at nighttime when people are stressed. And so even people who are not that much overweight, but people who struggle with their weight and binge at night, and we call this stress eating, or that's why we call them comfort foods, because people will stress eat on sugars and carbs. A lot of people are probably watching this are thinking, nodding their head, yeah, like, yeah, I do that. Topamax is an invaluable medication that I use. A lot of doctors don't know how to prescribe it. They look at, they think there's too many side effects. Well, there can be if you don't know how to dose it properly. Thankfully, I prescribe it for over 30 years now, so I'm very, very adept at knowing how to prescribe it and how to dose it. It's not for everybody, but for a lot of people, it's extremely helpful. So eating disorders is an extremely common problem we have in our society. The good news is there's treatments. People have to be willing to be treated, of course. And there's other types of eating disorders too, but those are the three main ones I want to talk about today. I hope you enjoyed what you heard today. If you like what you heard, please share with your family and friends. If you know anyone who's struggling with an eating disorder, please share this with them. And if you have any questions or comments, please send them my way. I answer every one of them. And thank you for watching. Hi, I'm Dr. Paul. Welcome to the Dr. Paul Show. Today I'm going to talk about PTSD. Before I get into it though, please press like and subscribe button to make sure you're getting all the up-to-date information. So today with PTSD is something I see a lot of in my practice. I work with a guy who works with the VA. So for over many years, I've seen a lot of veterans who come and see me. Some from the Vietnam War, some even from the Korean War. So people in their 70s and 80s, and some more recently with Iraq, Afghanistan wars over there. And not only that, even people who are not even deployed, but are, I saw a guy recently who, during training with the Marines and never got deployed, and during his training, he just had multiple injuries, and so many injuries to the point he had to retire from the Marines. He was hoping to be a vet. He was hoping to be a career a military guy, and he had to withdraw because his dream of becoming a pilot was gone, and so he's very traumatized by what he went through. So PTSD comes out in a lot of different ways. Some of the cases I see are people who've really seen some horrific things. For example, there's so many examples I could say right now, but people who see other people being blown up, body parts flying, people being killed, a truck hitting a landmine and people legs being blown off, and it's just a lot of just horror. When they say war is hell, it's true. It's terrible. Some of the stories I've heard. I mean, some of the stories have really brought me to tears, and so sometimes it's really horrible things, and sometimes it's just being there and being frightened. And there's some, for example, when a lot of people back then, the Vietnam War were drafted, and so they didn't want to be there, and they were forced to be there. And some of them said, I was afraid every day that I was going to die. I didn't want to die, and every day was a struggle for me. And they say, and I see one of my friends dying, and this person dying, and it's like I think I'm going to be next. And so what that leads to is a lot of problems. And it's not just in PTSD. We classically think about wars. It used to be called shell shock, but there's a lot of also PTSD from other things. Victims of crime, people who almost murdered, people who were raped, and also people who witness crime. So people who are to see horrific things. Sometimes that's it, and PTSD from people who have horrific childhoods. They're victims of child abuse. There are people who are victims of, probably the worst I see is childhood sexual abuse. A child being exposed to rape, and that's sometimes, really difficult to ever get over, really. And then and there's neglect, there's physical abuse, there's emotional abuse. Another modern example of PTSD is the LA fires. A horrific event that thousands of homes were lost. I think 39 people died. The worst event, the worst fire catastrophe in history, I believe. And so people who have lost their home, they've lost everything. And think about, when you lose everything, all the memories, all the pictures, the things you'll never get back again. You lose your house, you lose everything. Some people have lost their pets. The worst, obviously, is the loss of life. But even people who got out of the fire, which is most of them, thankfully, extremely traumatic to lose everything. Some people have no insurance on their homes, so now they're financially destitute, and there's really they feel like they have no hope. So, but even people who've gone through such horror, still, believe it or not, can feel better, with treatment. And again, like I said, I think some people feel guilty about that. They say, I don't think I want to feel better because, if I feel better, it takes away from what I went through. I go, no, it doesn't. I said, because there's nothing to take away from what you went through. But what this did to you is it shocked your system. And when you have a shock to your nervous system like that, it throws your chemistry off. One of the three main causes of these imbalances in the system is trauma. And genetics is a big one too, but trauma is a big one. And so people who are totally fine before, when they go through a trauma like that, can really be extremely depressed and very anxious and panic attacks and nightmares and all of the symptoms of PTSD. Flashbacks, all of that. So yeah, my daughter lives up in LA. Thankfully, she wasn't close to that, very close. But even she evacuated with other people, but I know patients. I have some patients who've lost their homes, and I have patients who know people who have. So. Anyway, that was a very, very sad, tragic event. Another very common, another example of PTSD. There's a lot of different things. And so what it leads to is a lot of dysfunction in life. And this can lead to a lot of nightmares, a lot of problems with sleeping, flashbacks. So flashbacks meaning that the person's like reliving the experience again, like it's really happening. There was a case that I saw of a guy who was in Vietnam, and another soldier had come up to him, and he took out of his pocket something that was shriveled up, and the guy said, "Well," he goes, "This is So this guy had hacked the ear off of a Vietnamese guy, and he was carrying around this guy's ear, and he was it was such a visual shock to him that he never really got over this. And so he's an older guy now, and his wife brings in a fruit basket. So when someone gave a fruit basket, the ones that have like maybe dried nectarines and when he saw that, he started to yell and scream because that visual reminder of that ear, and he yelled at his wife, "Take that basket away! Please don't take." And he said he went to the other room, he slammed the door, and he said my wife never asked me about it. I said I wouldn't talk about it, and so just something like that, a visual cue of something. Another example is that a lot of people who've been in war, they can't handle seeing any movies about war. They can't read anything about it. A lot of people just say they wherever they're going, they're always looking around. They're suspicious. They're looking for threats. A lot of people tell me that on the 4th of July with the fireworks, they can't handle it. So the one guy told me he would get earmuffs. He would get these earmuffs put over his ears on 4th of July so he couldn't hear it. And so even just any kind of a reminder, it just brings them back. And sometimes, the spouses will tell me that he'll wake up in the middle of the night screaming, and sometimes the spouse even gets hit or pushed because the person is coming out of a realistic nightmare and thinks that she's the enemy. And so, so I've seen this. Sometimes this one woman said that she sleeps in a different bedroom now because of that, because his nightmares are so horrific. So again, PTSD is a really tough thing. The great thing that, what I see when people come to see me, some people have been suffering for 50 years and they've never quite ever gotten better. So when I bring up treating them and I tell them, I can help you. I can get you feeling back to how you felt potentially before you went over there. And the problem is with some people is getting them to accept treatment, because a lot of men especially, they have that soldier mentality. They don't want to display signs of weakness. They think taking a medication is a weakness. And so, but sometimes I convince people to try to treat it, and amazing some of the results. If you watch my show, you've seen you've seen some of the videos we've done about some of the veterans I've talked to, and some of the examples. But yeah, it's amazing. I really enjoy treating these people, because when I see someone who's been suffering for so many years actually get better and actually feel happier, and actually their stress level goes down and they're able to handle things better, it's really satisfying for me to see people who've given up so much for our country to be able to give something back to them is very satisfying for me. A lot of times it's not just medications. A lot of people, they need therapy. The best type of therapy for trauma, for PTSD, is we call EMDR therapy. It's a specialized type of therapy that takes people back to that time. So it's a very difficult treatment to get through. The therapist has to be trained to do this type of specialized therapy, but it's the number one most effective type of treatment for PTSD is EMDR. It's called eye movement, something that has to do. I can't remember the full what it all stands for, but right now, but I've seen it work really, really well for patients. So anyway, but again, it comes in many forms, not just the war, but like I said, there's so many people who go through trauma. Sometimes even, it's obvious the loss of a loved one. Sometimes the loss of a loved one is very difficult, and people go through a very traumatic time. The most traumatic thing a person can go through is the loss of a child. So if someone's lost a child, that's something the person really never gets over, and that's the most significant loss a person can ever have in their life. So, but thankfully I've seen with some patients who've gone through that horrific event that they can still even feel better. Surprisingly, sometimes people feel guilty feeling better, which sounds odd, but some people think that I deserve to feel this way. If I feel happy, there's something wrong with that, because there's no reason I should be happy. So when I can get to a person and say, that's not true, what you've gone through is horrible, and I feel terrible for what you've gone through, and I wish I could take that away, and I can't. But one thing I can do is I can get you feeling better, and with what I do, and that's my job. And thankfully I have very, very good results with treatment of PTSD. So if you know anybody who suffers with this, please refer them to me. I'd love to talk to them about it. If you like what you see with this video, please Please share this with your family and friends. And please, if you have any questions or comments, if you could send them my way, I respond to every one of them. Thank you for listening. And please, like I said, also share this with your family and friends. Thank you.